the question is for an athlete, do they want to have springier tendons?
Yes.
Overwhelmingly, that answer is going to be yes. So collagen protein may land on the WADA watched substances list. They may be taking a look at this.
Yeah, it might be on WADA and USADA. We never know. Our friend Derek did just launch a type 1, type 2, type 3 collagen product. So,
and talking about exercise, collagen protein has been very popular. I know you discussed this with our colleague, Alec McCarthy, and kind of in the dermatology world, there's been a couple studies here and there where it looks like skin quality is improving, and the people are taking it because there's not a lot of downside. Of course, it's when it falls into the category of there's benefits there, but there's also a financial cost and sort of a medication or supplement burden. But I remember when one of these studies came out looking at the Achilles tendon, because Achilles tendinopathy is a very, very bothersome condition for people. It tends to be long-standing, like 6 months, people really aren't seeing any changes. This study looked at how does collagen protein affect the characteristics of the Achilles tendon. And this was also paired with resistance training. So they saw that the cross-sectional area of the tendon increased significantly compared to placebo. You still saw some improvement in the placebo group that was doing this, resistance training. Usually these are like standing calf raises where you're really loading the Achilles in an eccentric movement.
That's a good study, but is it repeatable?
And that was my question. So in this one, we had 11% increase in the cross-sectional area of the Achilles, 4.7% in the placebo group. So it's a small but significant change. And if you're trying to rehab a tendon injury, then, why would you not want to have more tendon volume there? Because I think it's something like 60% plus of the weight of tendons is actually collagen.
Yes.
So looking at another study that came out here recently, this one may have actually been this month or last month. But in any case, this was collagen supplementation in female soccer players. And in these athletes, they saw that the patellar tendon became stiffer. And the tendons are sort of like springs. And you and I had an interesting discussion before this talking about, does this translate to more power output? And the answer is probably. But
so.
Then is that protective of injury just because someone's able to have a stiffer tendon and put out more power? Because I think women are more prone to ACL injuries from what I recall.
Certainly so. And a lot of that is just the body dimensions and bone dimensions as well. But I think the jury's not out on that question. It's also kind of a question of if more muscle mass and more strength leads to more tendon injuries, if more exercise leads to ligament tears, do you stop doing that because of that potential risk? And the answer to that question, both for tendons and for muscle, is the same. Do it, but just be more cognizant of a slightly increased risk and do so safely.
Yeah, and I think if the question is for an athlete, do they want to have springier tendons?
Yes.
Overwhelmingly, that answer is going to be yes. So collagen protein may land on the WADA watched substances list. They may be taking a look at this.
Yeah, it might be on WADA and USADA. We never know. Our friend Derek did just launch a type 1, type 2, type 3 collagen product. So, a lot of people are taking this. Another interesting study that I've looked at some point, not for quite some time, is regarding the consumption of meat and basically collagen directly on the bone. So eating meat off the bone, whether it's chicken bone or beef bone, and basically eating every little bit off of it. When I went to Nepal for part of a summer or most of a summer to do trekking, and my roommates were from Nepal as well, I noticed that when they ate something, whether it's a water buffalo or a yak or a chicken or whatnot, they eat every tiny little bit of cartilage, tendon, ligament, and then it's just normal. And even the bones, you gnaw a little bit into the bone as well. And there is evidence that if you do that, then you don't need as much collagen protein. So think of this as like, your organ meat is your multivitamin. And then if you eat meat off the bone, like myself and my boys do, then you probably just don't need collagen protein as much.
It's interesting. So over there, they're not afraid of a little bit of gristle, but I know that there are children here in the United States, if they're biting into a chicken nugget, great source of protein, then there's some gristle in there, they're not going to eat it.
Yeah, a little gristle shouldn't scare anyone. Of course, if you're talking about a child like my 3-year-old, then you want to make sure that it's cut up enough to where they don't choke on it. So I think that was a
Pro parenting tip there.
yeah, nice little rabbit trail.
And I just thought this was interesting. In the first study I referenced, looking at the Achilles tendon, it was referred to as a specific collagen peptides, and we had to get the full version of the paper in order to get the secret recipe. So that's here on the screen for you all, and it consists of high amounts of hydroxyproline, high amounts of glycine, high amounts of proline. That's sort of the theme when you look at the collagen protein. So the secret recipe isn't really a secret, and thought we'd track that down for you all.
Yep. So enjoy the secret recipe. One other aside to collagen protein, obviously there's high amounts of things like proline and glycine. Depending on your genetics, you might need more or less. For example, I have 3 of 4 SNPs that lead to just more likelihood of peeing out glycine and proline. So over a long period of time, it makes sense to replace those so that there is enough. It can actually lead to things like osteoporosis and kidney stones. So depending on your genetics, you might have different needs. For example, someone with similar genetics to that might want to consume more protein throughout the day and not go OMAD, which is 1 meal a day.
Yeah, I think that's a really good point. And as the genetic understanding of these different SNPs gets better and better, I think we will move closer towards a precision medicine, and we'll say, okay, like this person has these SNPs, they're not at risk of anything, maybe to age 50. But then it's like, well, if you start adding in more glycine, for example, at a young age, then you're much less likely to have osteoporosis because glycine is heavily involved in bone mineralization.